After I posted a video about high functioning autism in toddlers, I had so many requests to speak on level 2 and level 3 autism in toddlers. So a couple days ago, I posted a video about level 2. And now, as promised, here is what you need to know about level 3 autism in toddlers. Level 3 autism is officially described as requiring very substantial support, according to the diagnostic manual, which basically means that these children experience the most significant challenges with communication and social interaction. Many level 3 autistic toddlers are completely nonverbal and they don't use sign language or gestures like pointing to communicate their wants and needs. They may pull a caregiver's hand and lead them towards what they want, but overall, communication is extremely challenging for these children. So imagine being a toddler and having all these feelings and needs and experiences, but having no way to express them, no way to say you're hungry or hurt, or that you just want to wear the freaking red shirt instead of the blue shirt. It's overwhelming just to imagine what they are going through. Keep watching this video because there is hope. It's not doom and gloom, and I don't mean for it to sound like it is, because it definitely is not. So, social interaction is another area of challenge. Many toddlers with level 3 autism have extremely limited engagement. They might seem like they're in their own little world with almost no eye contact and barely any response when you call their name. Toddlers with level 3 autism are more likely to engage in self-injurious behaviors like head banging, biting, or scratching themselves. This is likely due to a combination of factors, including frustration over not being able to communicate, sensory processing challenges. And by this, I mean that their brains either seek out or avoid certain sensory input. Head banging, biting, or hitting can sometimes provide sensory stimulation that helps them to self-regulate. Repetitive and stimming behaviors can also be very noticeable as well. You may see a lot of what seems like almost constant hand flapping, spinning, rocking, or pacing back and forth that are a lot more pronounced than in the other levels of autism. You may hear those vocal stims that I talked about in my level 2 video, but again, they may seem more constant and ongoing. But here's what I want every single parent to understand. Level 3 does not mean less capable. It just means needs more support. Every single child is unique and their potential is not defined by a diagnostic level by any means. Early intervention is absolutely imperative. So we're talking intensive approaches like ABA, specialized speech therapies, occupational therapy, and working with a developmental specialist. ABA focuses on breaking down skills into small teachable steps to help with behavior regulation, communication, and daily living skills. They work on reducing self-injurious behaviors, increasing attention and engagement, and teaching alternative ways to communicate, like using a picture exchange communication system, also known as PECS, or an augmentative and alternative communication device. Speech therapists also work on alternative communication strategies. So they'll do sign language, PECS, or the augmentative and alternative communication devices to help the child express their wants